Welcome to part 2 of our 4-part series on bovine fetal gender determination. In this second installment, we will focus on the details of identifying the male fetus. We are starting with the boys because I think they're a little easier. Remember that we're looking for the male genital tubercle, or GT, as seen in this gross specimen and corresponding ultrasound image, caudal and adjacent to the umbilicus as it exits the fetal body on the ventral abdomen. The ideal window for sexing falls between 60 and 80 days, although we can do it at 55 days and as late in gestation as we are able to visualize this location on the fetal body. Depending on the equipment you're using, this can become difficult over about 100 days or so, although with a little luck and a deeper penetrating rectal transducer, you may be able to recognize the gender at even 150 days. Remember, the umbilicus is our important landmark for identifying the presence or absence of a male GT. Learn to recognize this thick stalk of tissue as it exits the ventral fetal abdomen. Here are some things to consider with identification of the male fetus. In a perfect dorsal or sagittal view, the male GT is seen adjacent to the umbilicus in the same plane. However, in the transverse view, you will see these two structures separately as you fan forward and back along the long axis of the fetal body. As you develop an eye for getting oriented, this will become faster and easier. In the event of twins, make sure to try and identify the gender of both fetuses, as the presence of male hormones will most often render a female twin infertile and even affect the development of her reproductive organs. Be aware of other highly echogenic structures that you might mistake for a male GT, and be cautious to not misidentify the gender due to an oblique view that makes the structures difficult to distinguish. The fetal femurs, for example, can be pulled forward when the calf is curled up, superimposing bone over an area where a male GT might be seen. If necessary, adjust your probe orientation and try to examine the fetus in a different plane. Lastly, remember that as the GT develops into more fully formed reproductive organs, it will become less dense and look more like the end result, which is a penis and prepuce in a more typical soft tissue echogenicity. Here's our first example of a male fetus in a frontal plane. As the operator fans away from the fetal body, we are able to identify cross-sections of the forelimbs and umbilicus on the ventral aspect. Just caudal and adjacent to the umbilicus is the smaller, more highly echogenic male GT. Here is another bull in a mostly transverse plane. Note that we have to sweep back and forth between the umbilicus and the GT in this orientation, but that there is obvious distinction between the thicker and less echogenic umbilicus that trails off away from the fetus and the male GT, which is brighter white and finite in length. This frontal view image shows the umbilicus exiting the ventral abdomen and traveling cranially along the fetal body, with a distinct male GT caudal to it. We can also see the highly echogenic bones of the fetal hind limbs, reinforcing how important proper positioning is for interpretation. The dense tissue of the fetal tail could easily be mistaken for a female GT in a still frame. But since we're fanning through the planes of this fetus, we can follow the tail as it curls between the hind limbs. A negative female ID plus an obvious male GT lead to a confident gender identification. The male GT is seen only briefly in this image of a slightly later fetus, but it's reinforced with repeated sightings of a scrotum between the hind limbs. Combined with a good look at the tail region and the lack of a female GT, we can confidently identify this one as a male. This is a larger fetus in a transverse plane. We start at the caudal aspect of the fetal body and do not identify a female GT. Although yes, the cross-section of the bone of the spine could throw you if you couldn't look any further. Fanning forward, we see a distinct scrotum between the hind limbs, and then a male GT just caudal to the umbilicus. Note that the GT is a little less echogenic at this stage, as it matures from a small, dense embryological structure into a more recognizable penis and prepuce. Much like the last image, this large fetus in a transverse plane has more well-developed anatomy. The scrotum is most obvious, while the male GT is seen briefly, way off to the right-hand side of the field of view, adjacent to the umbilicus on the ventral abdomen. One can see where the dense fetal bone and large fetal size begins to make gender identification more difficult after 80 days or so. Once again, we give credit and thanks to Dr. Sandy Curran for providing these beautiful images.